there's also the potential spread of misinformation. So there's a lot of conspiracy theories going around. Should we believe the numbers that are coming out? What are the numbers telling us? And how can we help society think more medicinally and clinically when we see those numbers, instead of just coming up with our own theories and own opinions and conspiracy theories?
That's a really great question, Andy. So the first thing I would say is, look, we are, as we said, the good of internet. The bad is that we cannot curate information that's in the public domain as effectively as having well peer reviewed articles that are published in journals that are curated by experts that are going to look at certain things. Now, the reality is that if you go to the Johns Hopkins website, that tracking the coronavirus cases or mortality by location and demographic, the epidemiologists that are putting out these numbers ultimately are basing them on certain mathematical probability for the rate of infection based on what they've understood COVID-19 spread has been in different models like China, Italy, and now the US. But what these numbers don't ultimately account for is choice, right? I mean, individuals make every day, whether if you make, let me give you an example. If look at the 1918 pandemic flu strain, and this is the best example where numbers reflect large choices by a demographic. Mm-hmm. So in the 1918 pandemic flu strain, there were case models after the fact on two separate states within the US. And in one state, they practiced aggressive social distancing, and in another state, at that time, they had a military parade. Mm-hmm. And for all practical purposes, the state that ended up having the military parade was the one that essentially had a exponential growth in the number of cases and correspondingly increased in the morbidity and mortality. Mm. So what we are coming across, there are eventualities and outcomes that can be predicted based on the number of infections, the rate of infection, the spread of infection, and just really this balance between choices like social distancing methods, resources, and then the eventual concept of herd immunity, which is that if we can't get this under control, then the natural progression of this type of pandemic will become what would be called an endemic strain, which is that if you immunize or naturally develop immunity to enough people to the natural strain, eventually if it were to ever come back, those people would be potentially immune to their recurrent infection, similar to what we do with vaccinations. And or, there is a certain sense on if social isolation techniques are aggressive enough, then you're going to be able to curb the number of folks that are getting infected. Now, what is the limitation in that? One is rapid diagnostic testing, right? Mm. So to really aggressively get to social quarantining or physical distancing, you need to know whether you have the infection or don't have the infection. Now, the challenge is that there's only so much test that you have. And in medicine, testing has to lend itself to some form of action. I need to be able to do something with that test. Mm-hmm. So the general feeling and the general advice I think that makes a lot of sense is act as if you are sick, that you have the virus, because you're going to do the most aggressive social quarantining. The time where it benefits is that if your symptoms get worse and you have to go to the hospital, they can do a test to say, okay, diagnose. But ultimately right now, diagnosis only helps if there's drugs or vaccines or therapies to come with that. Right. Because what eventually it is that all viral infections ultimately is about symptomatic treatment, right? Correct. Fluids, hydration. Right. So the part is that the only symptomatic aspect of COVID-19 that we're understanding is that a lot of it leads to respiratory distress.
Right.
So what do you need? You need a ventilator to help manage that point where there's excess respiratory distress. But the aspect of testing is mainly from a public epidemiological social health perspective, where if I'm testing, the testing needs to lead to aggressive quarantine,
Right.
because that's the only way that testing can benefit at this perspective of social distancing. The other part I would say is that this physical distancing, a lot of people say, you know, well, why does it matter? You know,
Mm-hmm.
and there going to be a certain point where the number of cases are going to continue exponentially growing, in which case there isn't anything that I can do to make a difference. But the
Right.
reality is that you do make a difference, because it's a battle of having enough resources versus the number of cases that are constantly growing, right?
Mm-hmm.
So
Right.
even if, let's assume that you continue to get uptick in these number of cases. Today it's 500,000. Maybe in 3 to 5 months it becomes a million.
Mm-hmm.
But the mortality rates are still low, which then starts to approach more and more closer to the seasonal flu strain.
Mm-hmm.
The difference is that we can't compare it to the seasonal flu strain, because we know that it is much more potent than seasonal flu. The difficulty is it's not just the peak of the curve, it's the slope of the curve. Why?
Right.
Because the slope determines resource allocation, right? If the
Right.
slope grows too rapidly, then you don't have enough time to build the resources to compensate for the folks that are sicker, that end up going to the hospital. So it's just that is why individual decisions is so pertinent and so important. And I'm of the belief that it's better to be over precautious than under precautious,
Mm-hmm.
because at the end of the day, this is about social responsibility. It's not just about I'm in that demographic that's going to be having less mortality than the 80-plus-year-olds that are at a high mortality rate. This is about my decision impacts the loved ones of somebody else's family. My decision impacts my friends' loved ones. My decision impacts my elderly friends that I may have. So I think, yes, there's a lot of information out in the public. Not everything is curated. I think you have to trust the resources like the WHO, the CDC, CMS guidelines that are well peer reviewed, that are adapting and changing. But I think the urgency is important. I think whatever way people can talk about that urgency and the decisions that we make is critical to curbing this kind of rise in the number of cases.